The FedLife podcast is presented by Serving Those Who Serve, a fiduciary, fee-based financial planning firm serving federal government employees and retirees all over the country. This podcast is for informational purposes only and is not intended to be taken as financial advice. All listeners should consult their personal advisors before taking any action. The opinions expressed by our hosts are their own and do not reflect the views, policies, or position of Raymond James. Securities are offered through Raymond James Financial Services, Inc., member FINRA SIPC. Investment advisory services are offered through Raymond James Financial Services Advisors, Inc. Serving Those Who Serve is not a registered broker-dealer and is independent of Raymond James Financial Services, Inc. And now, here are your hosts. Dan Sipe serves as a branch manager for Raymond James Financial Services and Serving Those Who Serve. Ed Zerndorfer is our guest and federal benefits expert in the space.
Welcome, everyone, to the FedLife podcast presented by Serving Those Who Serve. I'm your host, Dan Sipe. Additionally, I am the branch manager here at Serving Those Who Serve and Lee Sipe & Associates. I'm going to begin, as I always do, by saying thank you. Thank you for taking the time to join us today. But above all, thank you for your service to the government, to the country, to me, to everyone. In normal times, you don't hear it enough. You're definitely not hearing it enough right now. The other thing you're always going to hear here is the guru, Ed Zerndorfer. He's back with us once again as part of our ongoing mission, say it with me, to reach, teach, and serve you, career civilian Fed. Once again, as is our wont, we follow some of Ed's Fed Zone articles. You can find those at fed-zone.com. That gives us one more way to reach and teach. And today we're talking about something that pretty much affects every single federal employee and retiree, and that is open season for FEHB. And so by the time this goes up, we'll be right in the middle of it. It runs, I know we're supposed to be outside of space and time in podcasts, but I break that rule all the time. It runs from November 10th to December 8th, 2025. Ed's covered all the important changes coming for the 2026 plan year. Premiums covering changes, new contribution limits, some plans that are going away. So, Ed, let's start with the big picture. You mentioned that the Federal Employee Health Benefits Program and the Postal Service Health Benefits Program cover about 8.2 million people. So when does this open season hit that we're talking about here again?
Oh, I just want to mention, Dan, though, in addition to the FEHB open season, we have the Federal Employee Dental Vision Insurance Program, FEDVIP. And then we have also the flexible spending accounts, for the healthcare FSA, dependent care FSA. So a lot of good stuff going on. So getting back to the FEHB, as you mentioned, during the open season, which starts November 10th, federal employees and retirees can change their FEHB plan, not only change their FEHB plan, but maybe go to a different type of coverage,
Sure.
From low deductible to high deductible, basic to standard. They can add maybe eligible some family members that were not on there before. These family members, like a spouse who had their own coverage, let's say private. They still want it, but they want the private coverage. They would like to become part of the FEHB. There's no life event here. That's what I'm saying. They can be added during the open season.
Gotcha. Now, Ed, here we go. Buckle up, folks. There's been so much buzz about this. Let's get to what everybody wants to know. Premiums. So what are federal employees and retirees looking at for premium increases 2026 under FEHB?
Under FEHB, this is the Federal Employee Health Benefits. We'll get to the Postal Service in a moment. Postal Service, because they have a separate, the Postal Service, in case I think some people not be aware of it, that the Postal Service, starting this year, has its own health insurance program. They used to be part of the FEHB. Now they have their own. It's called the Postal Service Health Benefits Program, PSHB. Well, for the Federal Employee Health Benefits Program, here comes the bad news. The average employee and retiree share premium. Employees and retirees pay on average, no matter what plan they're in, no matter what type of coverage they have, self-only, self plus one, self and family, they pay on average 25 to 28% of the total premiums, and the federal government pays the other 72 to 75%. So the average employee and retiree share premium increase for 2026 will be 12.3%. Sounds like a lot, but it's down a little bit from 2025 this year when it went down. It went down from 13.5% which was around this time last year for 2025. Now, if
Okay.
anybody's depressed about that increase, picked up my Wall Street Journal this morning, talks about the
Yep.
Affordable Care Act, the marketplace. November 1st started the open season between November 1st through December 31st. So if you're shopping around, get a marketplace plan to the Affordable Care Act, you're looking at maybe increases of much as 30% in terms of cost of plans. So let's not get too depressed here. I know I'm not. Yeah, I know it sounds like a lot, but boy, in private, it seems like it's more. I would say in private, even private companies offering health insurance plan, you're looking at increases for employees who are enrolled in plans, maybe 15 to 20% increases.
Sure.
So
so we're seeing that.
Go ahead.
We're seeing that rate of increase slow a little bit.
Yeah,
compared to last
everything
year.
is relative, but we got spoiled, Dan. Remember the days of 3 to 5%? Remember those days?
Oh yeah.
I don't think they're coming back.
Well, here's the problem, Ed. We keep getting older and we keep staying alive.
That's it.
That's it. So Ed, as you mentioned, our Postal Service employees and retirees are in the PSHB program. What are they seeing for this year?
Their average increases are about 11.3%, which is a little bit more than last year, which was 11.1%. So theirs is less than the federal, but it's double digit. It's double digit on loss.
Gotcha. And Ed, your article explains there's three main factors driving these increases. So what's causing the cost for 2026? Three
main reasons are rising costs from healthcare providers. Doctors, hospitals, everybody's charging more. A lot of it, Dan, has to do with post-COVID. When individuals didn't go to the doctor, they weren't taking care of themselves. And post-COVID, they started going to the doctor, had certain ailments that had to be taken care of, that they weren't taken care of when they were during the COVID. They were afraid to go to the doctor. So now healthcare providers are charging more. And suppliers of medical equipment has gone up in costs. Here, the second factor, a greater utilization of prescription drugs. The cost of prescription drugs has gone up, especially specialty drugs. And the third one is a higher behavioral health spending as access and utilization continue to expand. Individuals need to go to their psychologists, social workers, things like that. A lot of problems out there. A lot of it doesn't have to deal with post-COVID, the economy, whatever it is. There's more requests for behavioral specialists, and therefore the costs have gone up. Therefore, the insurance companies have to pay out more, and the premiums have to be raised.
Gotcha. So you mentioned the dental and vision insurance, FEDVIP. Let's talk about that. What type of premium changes are we seeing here?
Yeah, so not as much as health. The average overall dental premium increase was 3.35%, which is up from 2.97% in 2025. That's for dental. For vision, it's only going up about 0.47%, down from 0.87% in 2025. But there's something that employees and retirees have to note about the federal employee dental vision insurance program. Whether you're enrolled in a FedVIP dental plan, a FedVIP vision insurance plan, or both, employees and retirees pay 100% of the premiums. There is no government contribution when it comes to FedVIP, and the Federal Employee Dental and Vision Insurance Program. Employees and retirees pay the full cost of the premiums. So I always say that if you're really not very happy about the FedVIP program because of the government's not contributing anything, I suggest looking to buy maybe a private dental plan, individual dental plan, individual vision plan. Because what do you have to lose? You're paying the full cost of the premium. The government's like, so you might as well, find a plan that's more suitable and maybe less expensive. If you're in the private market, work with I advise employees and retirees to contact a licensed life health insurance broker who has access to individual dental plans, individual vision plans. If you're a retiree and a member of AARP, I know, you go to their websites, there are companies to offer dental plans to AARP members.
Gotcha. Okay, so the premium numbers are important, but beyond those, your article notes that there's some significant changes, some coverage changes happening, and you list some pretty important ones. Walk us through the major ones for FEHB and PSHB.
Okay, so FEHB and PSAB, the Postal Service Health Benefits, among the changes, it removed coverage for medical or surgical modification of sex traits, including gender transition procedure for all ages. It required coverage for FDA-approved HIV PrEP drugs and related monitoring with no cost sharing. Behavioral health access continues to expand. When we talked about why the costs have gone up for behavioral health access. Carriers must broaden networks and allow out-of-network care when waiting times are excessive. Opioid safety carriers must continue to provide at least one opioid rescue agent at no cost with expanded education on usage. And this has gotten to be pretty popular with all the advertisements about anti-obesity care. Carriers must continue to cover FDA-approved medications, including at least one, what's called GLP-1, and 2 oral options, plus behavioral and nutritional programs. So there is a push for individuals to watch their weight, to go to programs to cut their weight down. Let's face it, what part of the problems people have some health issues is because of weight issues. And I think this is a move in the right direction.
I would agree. Back in the day for OGs like me, we just had Weight Watchers. So it's great to have the expanded capability. So that's a lot of changes, especially around the preventive side and access to medications. That's awesome. So let's pivot back to FEDVIP. What's new here for 2026?
What's new in 2026 is that dental insurance carriers must now offer two routine exams, I guess at no cost, no out-of-pocket cost, and one emergency exam per year. Emergency. Now, I just want to note something about that. Many FEHB health insurance companies, like for example, we're in GHA, my friend. They do have coverage for up to 2 routine dental visits each year. We pay a little bit out of pocket for our routine checkups, each of us. All right, fine. So I don't consider that to be really, in terms of the dental plan under FEDVIP, to be really extraordinary. The emergency exam, maybe. But I just want to throw something in here. I mean, and I think, Dan, I know you're licensed insurance too. I've always maintained that dental insurance is not the classic insurance. What do I mean by that? What is the purpose of insurance? What is the purpose of insurance in general? Transfer of risk?
Sure.
You're paying a relatively small amount of money, a premium, to protect yourself against a financial catastrophe. That's why we have homeowner insurance. That's why, we pay, relatively small money. It's getting more expensive in case our house burns down. Home insurance is a bargain, even with a high cost. But with dental insurance, the real catastrophic costs, most plans are not going to cover everything. Give an example. Orthodontics. If I have to get reincarnated in life, I want to be an orthodontist. They got it made. They have it made. Do they have to advertise? No. Okay. Do they have emergencies at 3 a.m? No. Okay. But the point I'm trying to make is that, yeah, the FEDVIP plans, the dental plans, they do cover orthodontics, but only up to a certain amount. Like they'll pay, pay up to $4,000 treatment. Orthodontics will take payments of, over, for a 3-year treatment, a little bit over time, but they're not paying for everything. Crowns, bridges, the real expensive stuff. There's always a schedule how much they're going to pay for, after a deductible. And most importantly, does your dentist accept the insurance? I always advise individuals when it comes to health, that if they're enrolling in a health plan and they have a favorite health plan and they got favorite doctors, to make sure their doctor accepts that health insurance. Ditto for dental insurance. If you're looking into a dental plan during this open season and you find something, oh, that sounds good, boy, they really pay a lot. I have young kids, they have cavities. I have a teenager who's going to need soon to be an orthodontist. Before you enroll in that plan, check with your dentist to see if they accept that particular insurance. Not all do. Check with your orthodontist that they're going to accept the insurance before you enroll in that plan. Very important. So I got some mixed feelings about it. Vision insurance, again, you have to go to participating, ophthalmologist. You have to go to participating optometrist really to make it worthwhile. You have to make it worthwhile.
Gotcha. Okay, let's shift to flexible spending accounts, FSAFEDS. So, Ed, you point out some pretty significant increases to the contribution limits. Tell us about that.
Yeah, let's just review what the flexible spending accounts are. A program called FSAFEDS that allows federal employees, but not retirees, to enroll in a healthcare flexible spending account or a dependent care flexible spending account. Healthcare FSA is used to pay for out-of-pocket medical, dental, and vision expenses like co-payments, deductibles, co-insurances, or things the insurance doesn't pay for on a pre-tax basis. An employee is setting a portion of his or her gross salary before all taxes, federal, state, FICA, Social Security tax, Medicare tax, into this account that they can pull out tax-free to pay for out-of-pocket expenses. The dependent care FSA is used to pay for dependent care expenses for a child under the age of 13 and an adult that you claim as a dependent for adult daycare. The maximum contribution to the healthcare FSA during this year for 2025 is $3,300. It's going to increase to $3,400 during 2026. Now, the dependent care FSA, the maximum contribution hasn't changed in 20 years. It was $5,000. Now, what does that mean? What is $5,000? That's you're setting aside a portion of your gross salary to pay for the dependent care expenses of eligible dependents, like children under the age of 13. Paid to help reimburse for the cost of daycare, for nursery school, for summer day camp. And if you have it, let's say you have an adult who has to go that you claim as a dependent, mom, dad, you have to go to an adult daycare center, or somebody has to come to the house to watch mom or dad while you're at work. The limit was $5,000. $5,000. Now, when my kids were small enough, we used that dependent care thing. And I was in the government back then. This was 2003. I had 2 kids under the age of 13, and they were going to summer camp. $5,000 seemed to be enough. But then I ran into somebody who was younger than I was, an employee in their early 30s, and they had 3 children, 2 in nursery school, 1 was being taken care of at the house. Dan?
Sure.
That $5,000 was eaten up by February 1st. 1 month. So in 20 years, it took Congress to raise the $5,000 limit to $7,500.
Wow.
I always joke that Congress was still thinking we're paying babysitters 25 cents an hour.
Now, I just want to put a bow on this and make sure people understand this. With FSAFEDS, they have to re-enroll every year, correct? That's different from the health insurance.
Yes. With the FSAFEDS, if they're in it for this year in 2025, healthcare, dependent care FSA, or both, there's no automatic rollover to 2026. They have to re-enroll in it during the open season. Also, dependent care FSA, you have to, for the current year, you have to use up your money. You have to use up the money or else you'll lose it by December 31st. For the healthcare FSA, there used to be a use or lose situation in terms of using up the money by the end of the plan year, December 31st. But back in 2015, IRS allowed a healthcare FSA to have what's called a carryover provision. You can carry over a certain amount of unused healthcare FSA money set aside into the new plan year. Back in 2015, it was $500. For 2025, the carryover is $660. Now, what does that mean? Let's say we have an employee this year who's enrolled in a healthcare FSA, and looks like they're not going to be using up the money. They're not going to be using up their money by the end of this year. So they get to carry over to 2026 $660 into the new plan year. But the employee says, well, I'm really not planning to contribute anymore to the healthcare FSA, because let's say I'm going to retire. I'm going to retire March 31st, 2026. And as a retiree, I can't have a healthcare FSA. Well, you can use the carryover of the $660 to pay for any healthcare related expenses between January 1st and March 31st before you actually retire. But you still have to enroll. It's not going to carry you automatically. You have to enroll during the open season for 2000. Even though you're not going to be contributing, you're carrying over unused funds to 2026.
Gotcha. Okay, let's swing back to the FEHB side of the house and let's talk about plan options. So how many carriers and plans are federal employees able to choose from in the coming year?
For 2026, there are 47 insurance carriers and 132 plan options. If I say options, basic, standard, high deductible, low deductible, consumer-driven health plans, high deductible health insurance plans associated with an HSA. So there are about 132 plan options out there. In the Postal Service Health Benefits program, there's 17 insurance carriers and 75 plan options in the Postal Service Health Benefits program. There are fewer than a dozen dental and vision insurance carriers through FedVIP. This past year, I think there were 12 dental plans and four vision plans. This year, I think there's going to be 10 dental plans and 4 vision plans available for 2026.
Gotcha. Now, your article mentions that some of the plans are being discontinued. Now, that's really important for folks enrolled in those plans.
Yeah.
So which ones are going away?
The first one I'm going to mention was a shocker. I think Dan, you and I talked about this. The National Association of Letter Carriers, NALC, Health Benefit Plan, which is a consumer-driven health plan. CDHP is not going to be available. NA, the National Association of Letter Carriers, and NALC, Health Benefits Standard is not going to be available. That was a shocker. Health Alliance HMO Standard, AV Med Health Plan, High Deductible Health Insurance Plan, AV Med Health Plan Standard, Independent Health High, Blue Care Network of Michigan, High Deductible is not going to be available, and Priority Health. Again, I list these new articles for those of you, but here's what anyone listening today or are going to be listening before the end of open season, note this, because if your plan is not going to be around, you have to go into another plan. You have to enroll in another plan. And actually, there are two Postal Service Health Benefit plans that are two options that will not be available in 2026. And they are GEHA Indemnity Benefit Plan Elevate Plus, it's called. GEHA Indemnity Benefit Plan Elevate are not going to be available for Postal Service employees and retirees. As I said, participants in these plans must select a new plan during the season, or they will be automatically transferred into a designated default plan as follows. The FEHB default plan is GEHA Benefit Plan High Option. The Postal Service Health Benefit Default Plan is Blue Cross and Blue Shield Benefit Plan, FEP, it's called FEP, Blue Focus. And finally, FEDVIP, they have a default plan. It's called the Health Partners Dental Plan. And that plan will not be available. The FEDVIP Health Partners Dental Plan will no longer be available. Offered. Enrollees must select a new dental plan in order to maintain coverage during the 2026 plan year.
Gotcha. Folks, as usual, Ed has great examples and details with the article. So head over to FedZone, that's fed-zone.com, and read the article. Or as I like to say, Ed took all your notes for you already. So Ed, in sum, we've got premium increases across the board, important coverage expansions around preventive care, behavioral health, higher contribution limits for flexible spending accounts, and some plan changes people need to know about. So as federal employees are making their open season decisions over the next few weeks, what's your key guidance for them?
Look at your plan. See how your plan has performed this year. I'm talking about your federal health plan or Postal Service health plan. See how the plan is done for you. Has it served your needs? And if you have a family plan, you and your family's plans. And I would not concentrate on premium costs. Yeah, we know it's going up in costs. One of the mistakes individuals make many times when it comes to choosing a health insurance plan, they're looking for the cheapest plan. They're looking at the premium costs. The cheapest definitely is not always the best, because you have to consider what the plan does not cover. What are you paying out of pocket in terms of deductibles, co-payments, co-insurance? You have the freedom to choose any provider. You can go out of network if necessary, if you have a favorite doctor. You have to do your homework. Look back upon this past year. If you're looking for a plan that pays for everything, you're wasting your time. There's no plan, except the fact you're going to have out-of-pocket costs. And for that reason, don't forget about the healthcare FSAs. And if you're really like to save for the future, to pay for future out-of-pocket costs, maybe consider a high deductible health insurance plan associated with a health savings account, HSA, in which you can set aside money like a healthcare FSA, put money into an account, pull the money out tax-free to pay out-of-pocket medical, dental, vision expenses, not only for presently, but in the future, including retirement. So something to do. Now, just to dress it up a little better here, Dan, I have a FedZone column coming out within the next few weeks. It's entitled The 10 Biggest Mistakes that Federal Employees and Retirees Make During Open Season. The 10 biggest mistakes. And it just what I just mentioned in terms of looking only at premium costs doesn't mean it's a mistake. That's one of the mistakes. I got 9 more.
Gotcha.
That premium employees make. The originally was 5. When I started writing this, I went, hey, gee, I got more here. It expanded to 10. So that column will be coming out probably within the next 2 weeks. So please be on the lookout. It's entitled again, the 10 biggest mistakes that federal employees and retirees make during open season.
Well, there you go, folks. He's done it all. He's seen it all. And now he's doing it all to make sure he's helping you. Open season can be overwhelming, but you've got a place to come and making the best decisions. Ed, I don't know how you keep it all straight, but I'm glad you do. And I'm especially glad you do it with us. So on behalf of all feds and our team at Serving Those Who Serve, thank you for doing that.
My pleasure. It's always a pleasure. Helping feds. That's what we're here for.
Well, folks, that's a wrap. We are Serving Those Who Serve. Be sure to subscribe to this podcast on our YouTube channel. Hit that subscribe button. And on Spotify. And please remember to share it with your friends and even a few strangers. Don't forget our live webinars every single week. Just head over to the SWS website. That's stwserve.com. You'll see that webinar button, top right-hand corner. Click it. You're going to see the whole menu. The guru will come to you, reach you where you are, teach you where you are, and above all, serve you where you are. Sign up for one, sign up for all, and share that page with your friends. I promise you they will thank you. Be sure to read Ed every single week in the Fed Zone. That's fed-zone.com, and that's at swserve.com. So signing off as I always do for Ed, the crew at Serving the Serve, and me, Dan Sight. Good luck, Godspeed, and above all, remember, it's your Fed life. Make it a great one because you deserve it. Stay well, everybody. We are out.